Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we have Kelly Herbert, who is our COO of our practice. And Kelly is here to ask me hopefully some, difficult to or moderate to severely difficult questions.
I'm not going to take it too hard on you today, but today we're actually going to be talking about how surgery is not a one-size-fits-all approach. So I'm just going to jump right in. Dr. Ladner, what makes one 45-year-old's full facelift necessary, whereas someone else might just need a mid-cheek lift or their eyes done? Why does one 45-year-old need one thing versus the other?
Yeah, absolutely. So this gets into how every patient that comes in has to be customized, and it starts with listening. So when a patient comes in or they call in and they say, "These are the things that I'm noticing," we have to listen to those concerns. And then during the consult, obviously, we have to make sure that those concerns really align with what I'm seeing from an expert eye. And there are cases where I say, in fact, you would benefit maybe a little bit more from this other procedure you weren't thinking about. And I don't even think you need that other procedure, right? And we might do something totally different. Genetics plays into this. So eyes are a great example. We have folks in their 20s or 30s and 40s that really have pretty advanced appearance in terms of aging of their eyes that folks in their 60s and 70s don't have. And the same is true for necks and jowls and cheeks. So we really have to treat every person individually.
Right, that makes sense. So when someone comes in and says, "I want what my friend got," how do you handle that question?
Yeah. So again, their friend may have come in and had surgery with me a year, 2, 3 years ago. If they mention, that friend's name, I obviously don't mention names, as I can't do that. But if they mention it, I can reference and kind of see what they had without going into specifics. But again, I remind them that they may not have the exact same anatomy as their friend. They may not have the same parents as their friend. They don't have the same parents as their friend, right? So they have different genetics. And so together we go through their pictures, we go through their concerns, and I really kind of show them what result they would expect with that customized, tailored approach that's going to be more appropriate for them and not necessarily their friend.
Yeah, so talk to me about how some of these other things affect that one size doesn't fit all approach with bone structure, maybe skin quality, skin laxity, lifestyle. So someone maybe who doesn't eat a lot of protein or drink a lot of water and they drink a ton of alcohol. No, nothing wrong with that. But we just want to know, how does that affect your facelift?
Yeah, absolutely. So again, let's say that you have two friends. They're both 50 years old. One came in for a facelift with me, and that friend comes in, and he or she may actually be a perfect candidate for a facelift as well. Well, there may be other adjunctive things that I'm going to recommend with that facelift to optimize the results. So for example, let's say that friend has good volume in their face. Well, then we may not have to do a fat grafting procedure with that facelift. We may not have done it on their friend, but I'm going to recommend it to them if we're going to get the best result by adding a little bit of volume, creating a little bit of youth. Bone structure. We have folks that come in and, again, in their 20s and their 30s or 50s, and they've never considered the fact that they have really kind of weak bone structure in their jawline and their chin. And so to get the best possible result, we might want to augment that so that they really can get that perfect cervical mental angle, as we call it, so that nice clean cut jawline.
What does that mean, augment that?
Yeah, meaning a chin augmentation, right?
So is
to
that
actually
a
help.
chin implant?
That's
or-
exactly right.
Okay,
Yep.
got it.
Okay.
Okay.
And that's just one example of how their friend may not have had to improve the bone structure, but they need improvement of the bone structure to get that same result. Skin health. You mentioned skin health. This is where CO2 laser, for example, can go above and beyond what we can do with a facelift. So a facelift is going to reposition the tissues, right, in the face and the neck. It's going to get things back to where they used to sit, but it's not going to improve the skin health. And that's where CO2 laser can go above and beyond what we're doing with the facelift.
Great, that makes sense. So how about ethnicity and gender? Do those things play a factor?
Yeah, absolutely. I mean, ethnicity, there are some ethnicities that are just blessed. And so they're going to have thicker, better skin, right? Asian skin, African-American skin, Mediterranean skin sometimes can hold up a little bit better than, say, Northern European skin, right? So again, that will play into what I recommend in terms of, do we need to do something to help with that skin health, i.e. CO2 laser, fat grafting, right? So certainly ethnicity can play into it. When we look at male versus female, we're certainly going to tailor the way that we do the procedures differently with a man versus a woman. So, for example, the incisions are designed a little bit differently with a facelift in a man versus a woman, just because we have to consider the hair. We also have to factor in, for example, the brow lift recession of the hairline. And so men are going to be more commonly recessed in their hairline. We don't want to expose incisions. So all those things really kind of play into that customized approach.
And I've noticed with our male patients lately, you've been doing a lot of hemostatic sutures, for as an example. Is that just another way that you're customizing the facelift with a non-one-size-fits-all approach?
That's right. Yeah. So we know, via very good studies over the years that men tend to be a little bit more vascular when we're doing things like neck lifts and facelifts. And so knowing that, we're obviously going to take all preventive measures that we can to make sure that they're not going to have a problem after a neck lift or a facelift. And that's going to include things like hemostatic slings. It's going to include the use of drains, which we may or may not use in women, depending on the procedure. So we absolutely need to take that into account to make sure that we're not going to get into trouble.
That makes sense. Okay, so what happens when you have a patient bring in a photo of a celebrity and they say, I want to look just like him or her, or maybe they just want the cheekbones or the eyes? Are you able to give them that celebrity look?
Well, I always, right off the bat, I say, hey, I want to look like that celebrity too. But, it's probably not going to happen.
Right.
I remind them that you would have to have all of the exact same facial anatomy as that celebrity, right? Mm-hmm. All the way down to the bone, all the way down to your hair, your eyebrows, all these little things, right? To look like that celebrity. Mm-hmm. And so I gently remind them that what they're going for, what they need, may not really be in line with what they could achieve in terms of comparing themselves to a celebrity.
So how do you set reasonable expectations for a patient when they come in and what's actually even more common than a celebrity photo? We get many patients coming in with the AI photo version of themselves. Mm-hmm. And oftentimes it is unrealistic because AI is changing things like underlying bone structure, which you cannot do in surgery. So how are you resetting those expectations and giving them a realistic approach to their one-size-fits-all?
Yeah, I actually kind of answered this question a little bit with a little bit of a spin, which is I don't think that as surgeons we necessarily have the ability to reset expectations.
Okay.
I think it's actually more of listening to a patient's expectations during the consult and making sure that their expectations are in line with what we feasibly can deliver, right? Okay. So in other words, if a patient comes in and they clearly have unrealistic expectations, I'm going to mention that, right? Mm-hmm. Gently, but it's also part of my duty to say, hey, I think what you're looking for isn't really attainable. Mm-hmm. And if it feels like it's not a good fit, then I'll tell a patient that and say, I just feel like this isn't a great fit because what you're looking for, we probably can't achieve in my hands and quite frankly, in anyone's hands. So I think it's more listening for the expectations, but then I spend a lot of time going through what they truly should expect with the newest, latest techniques that we're using. And so if those two align, then I think it's going to work out really well for patients.
That makes a lot of sense. And it also kind of lends to the fact where we can't just give one person the same approach as we would the next. And we have patients call in every day asking for things like, well, what does price look like? What can I expect from my surgery? And that's really the importance of that consultation that you spend with them. You spend that hour going through what would be best for them in their particular situation. I think the very best way to avoid that one-size-fits-all approach that some surgeons do have, and we've talked about that in previous segments, is coming in for that consultation, meeting you face-to-face, and then going over what those requests are and seeing if those two things match up.
That's exactly right. And I always ask patients, I gently say, are you open to my suggestions? Being an expert, having done this for 15 years in my own practice, I'm only going to recommend things that I feel are going to get them the best possible result and optimize the result. I'm certainly never going to recommend a procedure that would make them look overdone or isn't appropriate for them. So it's going to be sort of guiding them, hand-holding in the right direction to advocate for them.
Yeah, that makes sense. Well, that's all the questions I have for you today, and I really appreciate it.
Thanks for being on the show.
Yeah.
And if you guys like what you heard, please like the video and subscribe to our channel.